Welcome everyone. So today we are going to learn about how to calculate total parental nutrition in neonates. So let's jump right into it. Total parental nutrition was first used in 1967 for an infant with intestinal atresia with post-operative weight loss, but it can be used as the sole source of nutritional support for neonates who cannot be fed or as an adjunct to enteral feeding. So what are the goals of total parental nutrition? First goal is to provide adequate calories and amino acids to prevent negative energy and nitrogen balance. And the second most important thing is to promote appropriate weight gain and growth while awaiting attainment of adequate enteral intake. So why TPN is important? There are short-term goals and long-term goals with TPN. The short-term goals with TPN is to increase the weight, to increase the length and the head circumference. It helps in the regaining of the birth weight. It helps in prevention of extrauterine growth retardation, retinopathy of prematurity, bronchopulmonary dysplasia, and necrotizing enterocolitis, which are very predominant causes of morbidity and mortality in the preterm neonates, and it also helps in reduction of morbidity and mortality. The long term goal is it helps in the age appropriate neurodevelopmental outcomes. So what are the adverse effects if no TPN is introduced? Short-term adverse effects like increased vulnerability to infection, free radical mediated damage, and greater need for ventilator support may be there. And long-term adverse effects include poor growth, poor neurodevelopmental outcome, increased cardiovascular risk of obesity, and reduced cell growth, which leads to reduction in the mass of kidney, pancreas, and heart. So, what are the goals of discussion today? We'll learn about indications of total parental nutrition in a neonate. We'll learn to set up starting of total parental nutrition in a neonate. What are the requirements of individual components in TPN and how to calculate TPN for a neonate? We'll learn that by one example. So, what are the indications of starting parental nutrition? For the common indications are any preterm born less than 31 weeks, we have to start TPN right away. In preterms born more than equal to 31 weeks, that means 31 weeks after, we have to start if no significant progress with enteral feeding is made within first 72 hours of life. That means first 3 days of life. If in a baby born after 31 weeks, no significant progress is made with enteral feeds, we have to start consideration for starting TPN. And in preterm and term babies who are unlikely to achieve sufficient enteral feeding within a stipulated time, due to some underlying pathology, we have to also consider starting total parenteral nutrition. Indications for starting parenteral nutrition if enteral feeding is stopped. For example, in a baby, enteral feeding was going on, but now it has been stopped due to some reason. So, when do you consider starting TPN for that? For preterm babies, we have to start TPN if the enteral feeding is unlikely to be started within 48 hours, and if the enteral feeding has been stopped for 24 hours and sufficient progress with enteral feeding is unlikely within the next 48 hours. Similarly, for term babies, we have to start TPN if the enteral feeding is unlikely to be restarted within 72 hours, and we have to start TPN if the enteral feeding has been stopped for 48 hours and sufficient progress is unlikely within the next 48 hours. So what is the timing of starting TPN? When indications are present, we have to consider starting TPN as soon as possible without any delay, but preferably within 8 hours. So what is the difference between peripheral and central nutrition? That means whether we give the TPN by a peripheral route or a central route. We have to see the recommendations by the American Academy of Pediatrics. It tells that always the central peripheral nutrition is preferred because the nutritional needs exceed the capability of a peripheral parenteral nutrition. When the parenteral nutrition has to be given over an extended period of time, for example more than 7 days of inability to take enteral feedings such as NEC, and in some post-op infants, the central nutrition is always preferred. And when there is imminent lack of peripheral venous access, always the central peripheral nutrition has to be preferred. But we can consider peripheral parenteral nutrition in following situations, but we can give with a maximum osmolality to 300 to 600 milliosmol per liter, in which situations while awaiting the placement of a central venous line And if the parenteral nutrition anticipated is for a shorter duration of time, for example less than 5 days, and if there is inability to establish central venous access. Umbilical catheters we can use for the administration of total parental nutrition. It reduces the number of insertion attempts without any increase in the risk of infection or increase in risk of NEC in comparison to peripheral parental nutrition, but there is increased risk of complications if it is left in place for more than 14 days. Two special precautions we need to remember. One is protection from light, another is filtration. The NICE guidelines recommend that the bags in which the TPN is administered have to be protected from light. Not only the bags but also the syringes and the infusion sets of both aqueous and lipid parental solutions have to be protected from the light. But the ESPN recommendations tell that only the lipid emulsions have to be protected from light, others need not be protected. Filtration, similarly, NICE does not recommend the filtration, while ESPN recommends 1.2 to 1.5 micron of lipids and 0.22 micrometer of other solutions. So while administering TPN, we have to remember this. The TPN is usually administered by two lines, line 1 and line 2. The line 1 contains dextrose, amino acids, electrolytes and trace elements, while the line 2 contains lipid and MBI. So for ease of that, we can remember that lipid MBI has to be administered in one line, everything else has to be administered in another line. Now both of these solutions have to pass through an infusion pump, but additionally the solution containing dextrose, amino acids, electrolyte and trace elements has to pass through a bacterial filter. Ultimately, the two lines have to be connected by a Y connector which will drain into the baby. So this is the basic setup of a total parenteral nutrition to a neonate. Now let's learn what are the requirements of individual components in TPN. So first let's see the energy needs. There are a lot of guidelines, NICE, ESPN, AAP, all of those things, but we have to always consider the NICE guidelines as a preferred way. So what are the energy needs? The energy needs have been divided. So whether we are considering in the first 4 days of life or after 4 days of life. So whenever we are considering in the within the first 4 days of life, the energy needs are 40 to 60 kilocalorie per kg per day, which has to be gradually increased to 75 to 120 kilocalorie per kg per day. On the other hand, if we are starting after 4 days of life, we can directly start at 75 to 120. Similarly, how much volume we administer, this is familiar to all the people who manage any neonates on a regular basis. This is basically the fluid therapy for newborns. In the term babies, on the day 1, we start at 60 to 70 ml per kg per day. We increase 10 to 20 ml per kg per day on every day, and ultimately our goal is to reach 130 to 150 ml per kg per day. Similarly, preterm, we start at 80, we add on 10 to 20 every day, ultimately we reach 130 to 150 ml per kg per day. For example, in a term baby, on day 1 he will get 60 ml per kg per day, on day 2 he will get 80 ml per kg per day, on day 3 he will get 100 ml per kg per day, on day 4 120 ml per kg per day, and on day 5 140 ml per kg per day. Likewise, in a preterm baby, on day 1 we'll get 80 ml per kg per day, on day 2 100, on day 3 120, on day 4 140, like that. Ultimately the final volume will be 150 ml per kg per day. We usually don't go beyond that. So what are the constituents of neonatal total parental nutrition? Let's come to the first constituent, that is glucose. So within the, just like the calorie requirement we read, in the first 4 days of life, we have to start glucose at 6 to 9 gram per kg per day, and we have to gradually increase it to 9 to 16 gram per kg per day. On the other hand, if we are starting more than 4 days after birth, we can directly start at 9 to 16 gram per kg per day. Important to remember is that glucose is available in the four common concentrations that we already know. It is D5, it is D10, D25 and D50. What do we mean by D5? It is 5%. 5% means 5 gram per deciliter. That is 5 gram per every 100 ml. Similarly, what is D10? It is 10 gram percent. That means 10 gram per every 100 ml. D25 is 25 gram per every 100 ml, and D50 is 50 gram per every 100 ml. Coming to the next component, that is the amino acids. In the preterm, in the first 4 days of life, it is 1.5 to 2 gram per kg per day, gradually increase to 3 to 4 gram per kg per day. After 4 days, we can directly start at 3 to 4 gram per kg per day. Similarly, in a term, in the first 4 days of life, it is 1 to 2 gram per kg per day, gradually increase to 2.5 to 3. And after 4 days, it is 2.5 to 3. See, the protein requirement or amino acid requirement is slightly higher for preterms than term, because the preterm babies have a slightly less residual store of amino acids or proteins in their body. Now the protein is available in form of aminoven injections. It is available commonly in two concentrations, that is 5% and 10%. Similarly here also 5% refers to 5 gram per every 100 ml and 10% refers to 10 gram per every 100 ml. Coming to the next component, that is the lipid and lipid emulsions. We use usually soybean oil, medium chain triglyceride, olive oil and fish oil for the lipid and lipid emulsions. There are three generations of lipid emulsions, as you can see here. First generation, second and third. The SMOF, full form of SMOF, is one of the common questions asked in quizzes and PG exams. It is SMOF refers to soybean, MCT, olive oil and fish oil. And the lipid component requirement is just like similar to protein. It is starting at 1 to 2 gram per kg per day, increased to 3 to 4 gram per kg per day. But if started after 4 days of birth, it is 3 to 4 gram per kg per day. Important to remember here is that in parenteral nutrition associated liver disease, of which lipid is the culprit agent, we have to give a composite lipid emulsion rather than a pure soy lipid emulsion. Constitutes of TPN, calcium and phosphorus. Similarly, the calcium requirement is in the first 48 hours after birth is 0.8 to 1 millimole per kg per day, gradually increased to 1.5 to 2, and after 48 hours of birth it is 1.5 to 2. Similarly, the phosphate requirement is given here. Important to remember is that in the solution we prepare, we have to always maintain a calcium is to phosphate ratio of 0.75 is to 1 to 1 is to 1. The calcium and phosphate requirement according to the different ages is given here. Now coming to the components, we have already learned that the carbohydrates are available in four concentrations: 5%, 10%, 25% and 50%. Amino acids and lipids are both available in the 10% concentration. Now let's learn about the other components. First, coming to sodium, potassium, chloride, sodium, potassium, calcium and magnesium. Now see here, this is a bottle of 3% saline or hypertonic saline. So we use this to administer our sodium requirement. So I want you to see the bottle here in a 3% saline 100 ml. This is a 100 ml bottle, but the concentration of sodium is 513 or nearly 500 milliequivalent per liter. 500 milliequivalent per liter means 500 milliequivalent in every 1000 ml. 500 milliequivalent in 1000 ml, that means 0.5 milliequivalent in every 1 ml. Similarly, I want you to see the potassium chloride injection here. This is a potassium chloride injection ampule in which each ml contains 2 milliequivalent of potassium chloride. See, each ml contains 2 milliequivalent of potassium chloride. Similarly, you can see the calcium gluconate injection here, that is the ampule, and this is the magnesium sulfate ampule there. So from the bottles I have shown you, you can see that we use, for sodium administration, we use 3% saline in which 1 ml contains 0.5 milliequivalent. In potassium, we use injection potassium chloride in which 1 ml contains 2 milliequivalent. For calcium, we use injection calcium gluconate, that is 10% calcium gluconate in which 1 ml contains 0.45 milliequivalent. And in the magnesium, it is commonly available as 50% magnesium sulfate solution in which 1 ml contains 4 milliequivalent of magnesium. The MVI or multivitamin injection, that is used at 1 ml per kg, and the trace elements is available in form of cell 4 by 5 or cell 4 or 5, and it is used only after 2 weeks. But as the parenteral nutrition is administered, we have to add heparin to that so that it doesn't clot, so that it reduces the risk of thrombosis. So injection heparin, which is commonly available in form of 1 ml containing 5000 unit, we add that to the parenteral solution at 1 unit per ml. So now we have learnt about all the components of parenteral nutrition. Now let's learn about the 7 steps of TPN calculation. So step 1 is calculating the amount of fluid required. Step 2 is calculating the amount of amino acid required. Step 3 is calculating the amount of lipid required per day. Step 4 is calculating the amount of supplements required per day. Supplements mainly sodium, potassium, calcium, magnesium and MVI. MVI we have already learnt, it is given at 1 ml per kg per day. Sodium is given at 3 milliequivalent per kg per day. Potassium is 2 milliequivalent per kg per day. Calcium is also 2 milliequivalent per kg per day. And magnesium is 0.3 milliequivalent per kg per day. So we can remember like this: sodium, potassium, calcium, magnesium 3, 2, 2.3. So that is the requirement per day. Now after that, in step 5, we calculate the amount of dextrose requirement by the GIR. GIR refers to glucose infusion rate. Step 6 is calculation of calorie nitrogen ratio and see if it is coming between 100 to 200 calorie per gram. The formula is given here. And step 7 is addition of heparin that we have already discussed. It is added at 1 unit per ml. The calorie nitrogen ratio that we discussed in the step 6, we need to calculate that because 30 non-protein calories per gram of amino acid is required for appropriate protein excretion. How do we ensure that? By calculating that the non-protein calories to the nitrogen ratio should be ideally between 100 to 250. The amount of nitrogen can be calculated by protein in gram multiplied by 0.16. Now let's discuss a case scenario. Imagine that this baby weighing 900 gram and born at 28 weeks of gestation has been referred and has reached your hospital on the 5th day of life. So obviously this indication we learned that any baby less than 31 weeks we have to start considering the total parental nutrition right away. So we have to start considering TPN here. So how do we calculate that? So remember the 7 steps we discussed for the calculation of TPN. First coming to step 1, that is the fluid calculation. This is a preterm baby, so we'll start at 80 ml per kg per day on day 1. This is a day 5 baby. We have to go in increments of 20 ml per day. So day 1 80 ml per kg per day, day 2 100 ml per kg per day, day 3 120 ml per kg per day, day 4 140 ml per kg per day, and day 5 will go to a maximum of 150 ml per kg per day. So the fluid requirement will be 150 ml per kg per day. That means 150 ml multiplied by 0.9, that is coming to 135 ml per day. So our first goal is, or first calculation is, the total fluid required by this baby is 135 ml. You can see the first step, fluid is calculated to be totally 135 ml. So what was our second step? Second step was amino acid calculation. So amino acid calculation per day, how do we do that? Remember this chart we learned. This is a preterm baby with 5th day of life. So more than 4 days after birth, the requirement is 3 to 4 gram per kg per day. So what do we do? 3 gram per kg per day. So 3 gram per kg per day means 3 multiplied by 0.9, that means 2.7 gram per day. So the total amino acid required by the baby per day is 2.7 gram. So we have an amino acid solution. How do we give that amino acid solution? The amino acid solution, we learned that it is available in form of 10% solution. So 10% solution, that means 10 gram in every 100 ml, 1 gram in every 10 ml. So 2.7 gram will be present in 27 ml. So the amino acid solution will be given as a 10% concentration. Total amount will be 27 ml. So our second step is amino acid requirement will be 27 ml. So out of the total fluid of 135 ml, amino acid will be 27 ml. So now is our step 3, that is lipid calculation. So similar to our amino acid chart, let's see the lipid chart. More than 4 days after birth in a preterm baby, so 3 to 4 gram per kg per day. So similarly, 3 gram per kg per day, 3 multiplied by 0.9, 2.7 gram per day, and the lipid is also available in 10% solution just like the amino acid. So the volume will come same, that means 2.7 gram will be contained in a 2.7 ml lipid solution of 10% concentration. So our calculation of step 3 is complete. So the total amount of fluid required till this point is 135 ml, out of which amino acid required is 27 ml and the lipid required is 27 ml. So now coming to the step 4, that is the supplement calculation. That means sodium, potassium, calcium, magnesium and MBI. MBI is the simplest because we have already discussed this is 1 ml per kg per day, so 0.9 ml per day. So we remember sodium, potassium, calcium and magnesium 3, 2, 2 and 0.3. So 3 milliequivalent per kg per day means 3 multiplied by 0.9, so that is 2.7 milliequivalent. Potassium 2 milliequivalent per kg per day, 2 multiplied by 0.9, it is 1.8 milliequivalent. Calcium similarly 1.8 milliequivalent and magnesium is 0.3 milliequivalent per kg per day. But this is the amount required in milliequivalent. Now how do we convert that to ml? We remember that each milliequivalent of sodium was contained in 2 ml of solution. That means to convert the milliequivalent to ml, we have to multiply by 2. So 2.7 into 2, that is 5.4 ml of 3% saline solution or hypotonic saline solution. Similarly, we learned that each ml of potassium chloride contained 2 milliequivalent. That means each milliequivalent was contained in 0.5 ml. So that means to convert milliequivalent to ml, we have to divide by 2. That is 0.9 ml of injection potassium chloride. Similarly, calcium, each ml contained 0.45 milliequivalent. That means 0.45 milliequivalent in each ml. So 1.8 milliequivalent, how do we convert that to ml? 1.8 divided by 0.45. That means 4 ml of injection calcium gluconate 10% solution. Magnesium sulfate, it was 50% magnesium sulfate. So how much was that? 0.3 milliequivalent, but each ml of magnesium sulfate was containing 4 milliequivalent. So 4 milliequivalent in each ml. 0.3 milliequivalent will be in 0.06 ml. So the total amount of supplements, how much it is coming? 5.4 ml of hypotonic saline, 0.9 ml of injection KCl, 4 ml of injection calcium gluconate, 0.06 ml of injection magnesium sulfate, and 0.9 ml of injection MBI. So the total amount of solution is coming combining those 11.26 ml of total supplements. So now our supplement calculation is complete. That means step 4, this total supplement required is 11.26 ml. That means we have calculated total fluid requirement is 135 ml. Out of that, amino acid is 27 ml, lipid is 27 ml, and the supplements totally amounting to 11.26 ml. Now coming to our stage 5 or step 5, that is dextrose calculation. We know that dextrose will be calculated and as per the GIR or glucose infusion rate. The total glucose will be given at 6 milligram per kg per minute. We know that glucose is given at 6 milligram per kg per minute. So 6 milligram per kg per minute. That means 6 multiplied by 0.9 to convert the kg, multiplied by 60 to convert the minute into hours, and multiplied by 24 hours to convert it to day. So totally 6 milligram per kg per minute is coming to 776 milligram per day. That means 7.776 gram or 7.8 gram per day. So the total requirement of glucose is 7.8 gram. So we have to give glucose total 7.8 gram, but in how much ml we will give that 7.8 gram? The total glucose volume will be total fluid volume minus the amino acid, lipid and additive volume. Total fluid volume is 135 ml. This much is the amino acid, lipid and supplements. Whatever amount is left, we have to use that as a GIR. So what is the glucose amount? 135 ml minus 27, 27 and 11.26. That is coming to 69.74 ml of dextrose solution. So we have to prepare a solution in which the volume is 69.74 ml and the amount of glucose is 7.8 gram. So the concentration will be, concentration always means amount divided by volume. So 7.8 divided by 69.74 ml, that is coming to 11.18 gram percent, or we can round it up to 11 gram percent or 11 gram per 100 ml. That means we have to prepare a solution in which the glucose concentration is 11 gram percent. So 11 gram percent means each 100 ml should contain 11 gram of glucose. If we give 69.74 ml of such a solution, it will deliver totally 7.8 gram of glucose. So how do we prepare that? we have to prepare an 11 gram percent dextrose solution. We have two solutions available, D5 and D25. We have to mix them in a perfect ratio so that the concentration of the resultant solution will be 11 gram percent. So how do we prepare that? I think everyone knows that the concentration of maximum minus desired divided by maximum minus minimum. Maximum is 25, desired is 11, maximum is 25, minimum is 50. That is coming to 14 by 20, that is coming to 0.7 or 70%. That means each 100 ml will contain 70 ml of D5 and 30 ml of D25, so that the resultant solution will be an 11 gram percent dextrose solution. That means out of the total volume, 70% amount will be D5 and 30% amount will be D25. But we don't have 100 ml to give the glucose solution. We only have 69.74 ml. So if the total volume is 69.74 ml, that is nearly 70 ml. What is the 70% of that and what is the 30% of that? 70% of that is 49 ml and 30% of that is 21 ml. So that means we have to prepare a solution for which the volume is 70 ml. How is that 70 ml made? It is made up of 49 ml of D5 and 21 ml of D25. So the total volume is 49 plus 21, that is 70, and this solution will have an in concentration or will have a concentration of glucose that is 11 gram percent. So we have our step 5, that is the 11% glucose concentration, the volume is 69.74 ml. Now coming to the calorie nitrogen ratio calculation. The formula is given here, carbohydrate calorie plus fat calorie into 6.25 divided by protein in gram per day. So carbohydrate calorie, we know that each gram of carbohydrate gives 3.4 calorie, and each gram of protein, or sorry, each gram of fat gives 9 calorie. So total carbohydrate, how much we are giving? 7.8 gram. We remember 7.8 gram. So it will give how much calorie? 7.8 into 3.4. How much fat we are giving? 2.7 gram. You remember the 2.7 gram fat will give how much calorie? 2.7 into 9. So we have to add that, multiply that by 6.25 divided by protein in gram per day. How much protein we are giving? 2.7. So the final calculation is coming to 117.63. It should ideally lie between 100 to 250 for it to be correct. So it is correct. So we don't need any minor modifications. So our 6 or 7 steps are complete actually, because the seventh step is actually just addition of heparin. So now we have to calculate the final fluid advice with heparin. So two lines are there, line 1 and line 2, as we have discussed before. Line 1 will be given everything except lipid and MVI. Line 1, so how much? Line 1 will be prepared by adding these solutions, everything except lipid and MVI. So how much dextrose we are giving? We have to give a concentration of dextrose, that is 11 gram percent. So how the 11 gram percent will be made? By adding D5 and D25. So how that will be made? By adding 49 ml of D5 and 21 ml of D25 respectively. Next, 3% saline, how we are giving that? 5.4 ml. KCl, how we are giving that? 0.9 ml. 10% calcium gluconate, we are giving 4 ml. Injection magnesium sulfate, we are giving 0.06 ml. Injection 10% aminovane or amino acid, we are giving 27 ml. So the total amount is 49 plus 21 plus 5.4 plus 0.9 plus 4. All this if we add, it is coming to 107.36 ml. So the total 107.36 ml will be given at over 24 hours. It is coming to around 4.5 ml per hour. So we have to add the heparin at a concentration of 1 unit per ml. That means for each ml we have to add 1 unit. So to this 107 ml we will add heparin 107 unit. That is a very minor amount. So how do we give the fluid in line 2? Line 2, as we discussed, everything, line 2 will be giving lipid and MVI. How much lipid? 27 ml lipid. MVI how much? 1 ml per kg. So 0.9 ml. What is the total volume? 27.9 ml over 24 hours. So how much it is coming? 1.16 ml per hour. So injection heparin will be 1 unit per ml. So to this 28 ml of fluid, we'll add 28 unit of heparin. So finally, two peripheral bags will be connected, or two bags will be connected, bag 1 and bag 2. In bag 1 there will be 107 ml of solutions containing all this, and in bag 2 there will be 27.9 ml of solutions containing this, with added heparin in both. Bag 1 will pass through an infusion pump with a bacterial filter. Bag 2 will directly pass through an infusion pump. Both will be connected by a Y connector, and both will be going into the baby, so that will meet the parenteral nutrition requirement of the baby. So this is the basics of how to start total parenteral nutrition for a neonate. So thank you everyone for your patient listening. Please give your feedback, and if you like this video, for more educational videos, please like, share and subscribe with your friends. Thank you.